A 22-year-old male presents to the emergency department with abdominal pain, vomiting, and sweet-smelling breath. He has been unwell with feverish symptoms for the last 5 days and has a past medical history of type 1 diabetes mellitus. His observations show respiratory rate of 25 breaths per minute, heart rate of 85 breaths per minute, blood pressure 120/84, temperature 36.8, oxygen saturation 97%. Which of the following criteria is used to define resolution of this patient's likely diagnosis? Okay, so the likely diagnosis in this case would be diabetic ketoacidosis, right? Judging from the age, more likely to be type 1 diabetes, a younger age group. Abdominal pain, vomiting, sweet-smelling breath is known as the sweet-smelling breath is from the ketones. Smells like acetone from the nail polish. He has been unwell with feverish symptoms, so this infection for the last 5 days probably triggered his DKA. As you have infection, you have increased metabolic needs. However, your body doesn't produce enough insulin to import glucose into your cells, and hence you cannot meet the increased metabolic needs, energy needs, and hence your body starts to look for alternative sources of energy other than glucose. So your next one is breaking down fats to produce ketones. So you have ketoacidosis. His observations show respiratory rate is high, heart rate is normal, blood pressure is normal, temperature is normal, oxygen sats is normal. How do you define resolution of DKA? So DKA is diabetes, blood glucose more than 11, I think. Ketoacidosis. So ketones more than 2 plus on bloods, 3 plus on bloods, 2 plus, more than 3 millimoles on bloods, more than 2 plus in urines, if I'm not mistaken. I have to check that later. Is it 0.3? Is it 3 or 0.3? And acidosis pH less than 7.3. So resolution would be pH more than 7.3, serum ketones less than 0.3, I guess. I will need to check later. So the answer is, I got it wrong. The answer is pH of more than 7.3, ketones of less than 0.6 millimoles per liter. DKA resolution is defined as pH more than 7.3, blood ketones of less than 0.6, and bicarbonate of more than 15. Okay, millimoles per liter. Maybe it's the unit thing. The 3 that I remember could be mg per dl. Let's have a look. The correct answer is venous pH more than 7.3 and serum ketones less than 0.6 millimoles per liter. This patient is likely suffering from diabetic ketoacidosis, DKA, a condition characterized by uncontrolled lipolysis, resulting in an excess of free fatty acids, which are converted to ketones. The most common precipitating factors are infection, poor insulin compliance, and myocardial infarction. DKA commonly presents with abdominal pain, polyuria, polydipsia, dehydration, spasmodic respiration, which is deep hyperventilation, and acetone-smelling breath, pear drop smells. The main principles of management in DKA are fluid replacement. Isotonic saline is used initially, even if the patient is severely acidotic, and once blood glucose is less than 15, an infusion of 5% dextrose should be started. Correction of electrolyte and disturbance. Serum potassium is often high on emission despite total body potassium being low. This often falls quickly following treatment with insulin, resulting in hypokalemia if potassium supplementation is required and the rate of infusion is greater than 20 millimoles per hour. Cardiac monitoring may be required. Long-acting insulin should be continued. Short-acting insulin should be stopped. DKA resolution is defined as venous pH more than 7.3, serum ketones less than 0.6 millimoles per liter. Please note the remaining answers are incorrect as these are not used as the thresholds to define DKA resolution. Okay. So you have the American one and the British one. We follow the British one in our university. So glucose more than 11, pH less than 7.3, or bicarb less than 0 is less than 15. This is the acidosis part. Ketosis part is ketones more than 3. Okay, so for diagnosis, you need ketones of more than 3. However, for resolution, you need ketones of less than 0.6. Yeah, okay. So there's a difference between diagnosis and resolution. Okay. Urine ketones plus. So diagnosis, glucose more than 11 or known DM, pH of less than 7.3. Let's go with the name diabetic ketoacidosis, right? Diabetic is glucose more than 11. Keto is ketones more than 3, or serum ketones more than 3 millimoles per liter, or urine ketones more than 2 plus. And acidosis is pH less than 7.3 or bicarbs of less than 15 millimoles per liter. Okay, something to commit to memory. And then resolution is different in the sense that glucose is the same. So no, they don't talk about glucose in resolution. Okay. They talk about pH and ketones in resolution. So pH of more than 7.3 is and ketones level of less than 0.6 millimoles per liter, or bicarbonate of more than 15 is resolution of decay. Okay.